Cochlear implants were originally intended for individuals who had lost their hearing in life. In 1990, the NIH came out with a consensus statement, and we began to very seriously consider children born deaf for cochlear implantation. Over time, the age of implantation in the U.S. has gradually dropped down to 1 year. In Europe, it's 9 months or even earlier. A lot of this has to do with the fact that as we've implanted deaf children, we've discovered a lot about the neurobiology of children and language we had not appreciated prior to the advent of cochlear implants. Taking a child who's born deaf. Now, if you implant a child who's born deaf at 1 year, at 1 year they're going to be behind their peers in language development. Not surprising, they're deaf. But over the next several years, their language development will mirror and often overlap the language development of their normal hearing peers. And that development continues throughout grade school, middle school, and high school. And while there are some unique challenges to a child with a cochlear implant learning language, it's remarkable the level of function, almost near normal in the majority of them, that they will develop over time, often being mainstreamed as normal hearing in terms of their college and/or job opportunities. When I was at Walter Reed, I had the child of a general surgeon in the Navy, born deaf. The child was caught during the newborn hearing screening, identified, amplification was tried as it should have been, and then at 1 year, on the child's birthday, we did cochlear implantation. The child has a twin. Their language is the same now several years out, even though one is normal hearing and one has a cochlear implant. And so the benefit to that child of a cochlear implant was astounding. It markedly improved that child's ability to communicate and learn. Now, what's interesting about a child is if we implant them at that young age, their performance with language development is astounding, again, mirroring their peers. If we wait over time, if the child is not identified until 2 or 3 and does not receive an implant until 2 or 3 years of age, while there is a great deal of catch-up, they often will lag behind their hearing peers in language development for years because much of the neurodevelopment has occurred without sound. And by identifying the child early and implanting at that early age, their language development, again, is normal or near normal.